But now, and I think since the pandemic, people are really, I think the word is, they're fearful. And look, who can blame them? There has been an absolute climate of fear that has been created. But I thought it might be helpful to put to you some of the fears that some of my friends have put to me. And you as the insider on the one hand, but you're also someone who wrote a lot about COVID, wrote a lot of things that sometimes were called conspiracy theories and turned out to be completely true. So first question, were you able to do that? You went very much counter the COVID narrative in your writing. Did you get pushback from the UN or at your university for that matter?
The last question, no, I have not received a single pushback, but there's a lot in what you said, and I could talk for an hour just to respond to that. Let me say things very quickly on some of those issues. I think the fear that people have about overreach by the WHO, the World Health Organization, which, as you said, is part of the UN system, I think that fear is entirely justified, and I want to come back to that and explain why the fear is in fact justified. Secondly, we used to say that the key to understanding the United Nations is it exists so that countries that are unable to do anything individually can get together to decide that nothing can be done collectively. So yes, again, there is a lot of merit in that. However, even in things you said, you expressed many of the misunderstandings about it. For example, you said tax-free income. Now you pay and I pay at the moment our taxes to the Australian government, which gets distributed between state and federal level, okay? UN employees do pay tax, but to the United Nations. So the exemption is from national tax. About 1/3 of my salary for the entirety of the UN system went to the UN as staff assessment, the direct equivalent of tax. And the benefits you get back are very similar. So my pension comes from the UN, but I was contributing to the UN pension scheme, et cetera, et cetera. Our travel allowances were actually less generous than any typical Western country. The US is actually exceptional in the rigor of its travel restrictions for its public servants. But certainly living in Tokyo, even as an assistant secretary general, I was worse off than I would have been as a Japan-stationed Australian diplomat. So I think we need to be a bit careful of that. As I said, there's a lot of stuff there. Now, with the WHO, now also one other thing, by the way, while I was with the United Nations, we did a major study from the United Nations University, which we published as a book called The Unintended Consequences of UN Peacekeeping, in which we detailed, using a lot of internal information and data, we detailed many of the pathologies that people complain about with the UN, including sexual exploitation of people by the peacekeepers, the unaccountability of peacekeepers. Why is that? Because countries that contribute troops will not allow investigations and punishment to be done by the United Nations. They say, no, you tell us what the matter was, and we will investigate and, if necessary, take any action. So that's a good example of how control is retained by member states. Now, with the WHO, when we started off, the WHO did a lot of very useful work, including the eradication of smallpox. And there is a need for an international institution that collates information and coordinates and gives technical advice, particularly to countries that lack technical expertise and that lack financial resources. So yes, it did a lot of good, but its response through the COVID era has been disappointing, to put it mildly. It came up with a wonderful synthesis report in September 2019. And by then, there must have been COVID circulating already. And that report has been validated by the fact that the WHO changed around and recommended things that it had said not to do in that report. And other governments took that up, including closures and lockdowns and all sorts of things, school closures, for example. And that report in September 2019 was based on a century's worth of data and collected wisdom of the health experts. The turnaround, complete turnaround, was based on one city's experience in one country, Wuhan. A lot of the data we now think was spurious and fabricated. For example, people dropping dead on the streets. It resulted in overreach of state power. It resulted in massive transfer of wealth from poor people and middle classes to big pharma and big tech and things like that. And a lot of these, surprise, have financial stake and contribute to the WHO. So from the original time, the proportion of funding that the WHO receives from what we called non-assessed contributions, in other words, discretionary voluntary funds provided to the WHO, that now accounts for about 75% of total WHO funding. So just like in our case with the TGA, the Therapeutic Goods Administration, when 96% of its funding is derived from the industry it is meant to regulate, you think, wait a minute, there's a slight conflict of interest there, and maybe their conclusions reflect the interests of the people giving the money.